February to April is the peak season for an exquisitely painful and common viral infection known as shingles. Shingles is the colloquial term for herpes zoster. It is caused by the same virus that causes chickenpox. The virus is not extremely contagious. It tends to affect elderly people or people whose immune system is compromised by chronic illnesses like diabetes, in alcoholics, in HIV patients, in underweight or malnourished patients. The rash is pretty characteristic and it is a clinical diagnosis. What happens first is symptoms of mild viral fever. So mild fever, body pain, tiredness. The next day you will develop pain, a severe nerve-like pain on one side of your body. 2 days later you will develop the characteristic rash. Usually they look like studded raindrop-like vesicles filled with clear fluid. The illness runs a course of about 10 to 14 days. This can be limited with the use of antiviral medication. The rash will clear up first, but the pain may last for several days or several weeks, in some cases for certain months at a time. The risk factors are elderly people who are weak or whose immune system is compromised by chronic illnesses like diabetes, renal illnesses, chemotherapy, taking antibiotics for a long time. In alcoholics and malnourished people, the pain may last for several months at a time. The key here is to identify the rash quickly and begin the antiviral medication within 48 hours of the development of the disease. If you are pregnant, you have to be extremely careful with treating the illness aggressively and urgently. The antiviral medications are safe in pregnancy as well. The pain can also be limited with painkillers and tricyclic antidepressants. There is vaccination as well available against the varicella zoster virus. Although if you have already been exposed to the virus, then the vaccination may not really protect you. It is 2 doses given underneath the skin that can provide 95% protection against the rash. There are certain misconceptions. People believe you shouldn't have a bath when you have a viral infection like chickenpox or shingles. That's not true. You're only risking bacterial infection as well. Avoid going out in the sun during this duration and drink plenty of fluids and get plenty of rest.